Dr. Sarah Chen arrives at St. Helena General as an unremarkable trauma surgeon. Quiet, methodical, her hands steady, but her eyes carrying the weight of something no one asks about. When Chief Surgeon Dr. Marcus Holloway witnesses her unconventional surgical approach during an emergency procedure, he dismisses her as reckless. But 30 seconds into the operation, his skepticism evaporates. What emerges is not just technical mastery. It's the muscle memory of someone who has operated in conditions most surgeons never face. As Holloway's doubt turns to curiosity, Sarah's carefully constructed life at the hospital begins to unravel. Her colleagues sense it. Her past, classified military service, field operations in conflict zones, decisions made under fire that still wake her at 3 in the morning, begins to surface through the cracks in her silence. The story explores the invisible burden carried by healers who have learned to save lives when there are no resources, no protocols, no second chances. It asks whether redemption through service is genuine healing or just another form of hiding. And it reveals that sometimes the most dangerous person in a hospital is the one who knows exactly what it costs to keep someone alive. Chapter 1. The Unremarkable Surgeon. That night, no one expected a simple emergency to expose the truth behind the quiet surgeon in the corner. What began as routine became the kind of story no one in that hospital would ever forget. Before we begin, subscribe and turn on the bell, because some heroes don't wear scrubs, they carry invisible scars beneath them. The ER alarm sounded at 11:47 p.m. on a Tuesday. Sarah Chen didn't look up from her coffee, black, no sugar, lukewarm by now, as the code was called overhead. Trauma incoming, MVA, multiple injuries, the familiar language of crisis. She'd been standing in the surgical lounge for 43 minutes, reading a journal article about hemostatic techniques. The fluorescent lights hummed their constant 60 Hz drone above her. Outside, rain moved horizontally across the windows in sheets. November in Boston, the kind of cold that made people drive too fast and think too slow. Sarah set down her mug. The ceramic made a soft click against the table, the only sound she made. No rushed movements, no theatrical urgency. Just a deliberate pivot from sitting to standing, a straightening of her white coat, a check of her hands to ensure the tremor from this morning's insomnia wasn't visible. By the time she reached the trauma bay, the ER resident, a young man named Torres, all nervous energy and textbook training, was already calling out vitals. 38-year-old male, head-on collision, GCS 8 on arrival, fractured femur, possible internal bleeding, chest trauma. The patient was already being prepped for OR. Sarah stood at the periphery, watching, observing. This was her method. Never rush the scene. Never let adrenaline make decisions. Let the crisis breathe. Let it show you what it actually is. Dr. Marcus Holloway burst through the doors, like he always did, commanding, assured, his voice carrying the weight of 20 years as chief surgeon. He was good. Everyone agreed on that. Technically excellent. Operationally sound, the kind of surgeon who moved with the confidence of someone who had never questioned whether his hands knew what to do. He barely glanced at Sarah. "Get him to OR2, Holloway ordered. "I'll lead. Someone get me a preliminary scan." "Scan will take 8 minutes, Sarah said quietly. She was already moving toward the bed, her eyes on the patient's pupils, his breathing pattern, the way his left arm lay at an unnatural angle. "We don't have 8 minutes. He's bleeding into his abdomen. Femoral artery, maybe. Or he's got a collapsed lung we're missing." Holloway's eyes snapped toward her. She watched the calculation happen behind them, irritation that a junior surgeon had interrupted his rhythm, mingled with the beginning of something else. Doubt, maybe, or curiosity. "We follow protocol, Chen," he said, his tone final. "Scans first, then we move. That's how we practice surgery in this hospital." Sarah didn't argue. She never did. She simply nodded, continued walking beside the gurney, and kept watching the patient's sternum. The slight, almost imperceptible rise and fall. The patient was losing consciousness, not from sedation, from blood loss. When they reached OR2, the team was already scrubbing in. Sarah positioned herself at the sink beside Torres. The water was hot. The soap smelled like every hospital everywhere, clinical, precise, the smell of ritual. She scrubbed methodically. Fingers first, palms, between the knuckles, up the forearms, no rushing. Technique mattered most when time mattered least. Holloway was beside her, his movements quicker, more confident. He glanced at her hands, the steadiness of them, the practiced rhythm. "You always scrub that carefully?" he asked. Not unkind, just observing. "Yes," Sarah said. She didn't offer explanation. Inside the OR, the anesthesiologist was already working. The patient's chest rose and fell mechanically now. The monitors beeped their electronic song, oxygen saturation holding at 88%, blood pressure dropping. Everything on that screen was a line moving toward a cliff. Holloway made the first incision. Sarah stood across from him, prepared to assist, her instruments laid out in an order that was unconventional. Hemostats before clamps, suction closer than usual, a secondary tray prepared with blood products arranged in a sequence that made the nurses glance at each other with quiet confusion. The chief surgeon opened the abdomen. Blood. Immediate. Dark. The room suddenly tilted toward emergency. Holloway's hands moved with precision, searching, isolating, beginning the methodical dance of stopping the bleeding. But 30 seconds in, Sarah saw it. The angle was wrong. Holloway was approaching from the typical entry point, the textbook position. It would work, it always worked, but it would take time, and time was a hemorrhage. Without thinking, without permission, Sarah reached across and gently repositioned the retractor. "Different approach," she said quietly. "Left lateral dissection, 2 minutes faster." The room froze. The nurses stared. Torres held his breath. Holloway's eyes met hers over the surgical field, and then something changed in his expression. Not anger, recognition. "Do it," he said. Sarah moved. Her hands took over with a fluidity that belonged to someone who had performed this procedure not in a teaching hospital's gleaming OR, but in field tents with mortar fire echoing outside. She knew exactly where the bleeding was without needing to look. Her muscle memory knew the geography of trauma. The hemostasis took 90 seconds. The blood loss was contained. The patient lived. When it was over, when the incision was closed and the patient was being moved to recovery, Holloway was still standing across from her. His eyes had changed. The mockery was gone. In its place was a question about who she really was. Chapter 2. The Method. The next morning, Sarah's hands were shaking. Not visibly, never visibly, but she could feel it. The micro-tremors that came after adrenaline metabolized, after sleep didn't come, after memory flooded back in the shape of a surgical field and a patient's exposed abdomen and the weight of staying invisible. She sat in her apartment, a sparse one-bedroom in a grey building that didn't ask questions, and held the mug of tea without drinking it. The steam rose and dissipated. Outside, Boston was grey and wet. The sky had pressed down low overnight. Her phone was already populated with messages. A text from Torres. "That was incredible last night." An email from the nursing director flagging her unconventional instrument arrangement as a deviation from protocol, and a calendar invite sent at 6:04 a.m. from Dr. Marcus Holloway. "My office, 9 a.m. today." Sarah had known this was coming, not this fast, maybe, but coming nonetheless. The invisibility couldn't hold forever. Nothing invisible held forever. Exposure was just a matter of time. By 9:04 a.m., she was sitting in a chair across from Holloway's desk. His office was what you'd expect. Degrees from Hopkins and Harvard on the wall, photographs with hospital administrators, a view of the Charles River frozen halfway between autumn and winter. Holloway didn't start with protocol violations. He started by leaning back in his chair and studying her the way a surgeon studies an X-ray, looking for fractures in the surface. "Where did you learn to operate like that?" he asked. Sarah didn't deflect. She didn't have a prepared answer, which meant she defaulted to the truth. Training. "That's not Johns Hopkins training," Holloway said. His tone wasn't accusatory, observational. "I trained there too. That's not their style." "Military field medicine," Sarah said quietly. The words sat between them like a confession. "Trauma protocols developed when operating theaters are exposed and supplies are limited." Holloway nodded slowly. He wasn't surprised. He'd already guessed. What he needed now was confirmation. "How long?" he asked. 8 years, Sarah said. 3 combat deployments, 2 additional years in advisory capacity. He absorbed this without judgment. A man who'd spent his career in a hospital knew exactly what 8 years of military trauma surgery looked like. It looked like someone who'd seen suffering that never appeared in teaching cases. Someone who'd learned that protocol was a luxury, not a law. "Why here?" Holloway asked. "Why St. Helena?" This was the harder question. Sarah considered lying. She'd become good at partial truth over the years, but something about Holloway's straightforward gaze made her answer honestly. "I needed to stop hearing screams every time I closed my eyes," she said. "I thought helping people in a hospital where I could actually follow protocol, where people survived, might make the screams quieter." Holloway was silent for a long moment. Then he stood and walked to the window. Rain was beginning again, speckling the glass. "Your method works," he said. "That patient last night would have died with conventional approach. 12-minute operation, maybe 14. His BP would have crashed by minute 7. You gave us 90 seconds of hemostasis and another 90 to resolve the secondary bleed. You saved his life. He was lucky," Sarah said. "No," Holloway turned back to her. "You were precise. Luck is what people who don't understand surgery call skill." He returned to his desk and began typing something on his computer. Sarah sat motionless, waiting for the other verdict, the one about protocol violations and the nursing director's concerns. It didn't come. Instead, Holloway printed something and slid it across the desk. A form, a request to formally integrate Sarah's field methodology into the hospital's advanced trauma protocol. "We're going to do this properly," he said, "not hiding it, not positioning you as an anomaly. We're going to document your method, teach it, and make it part of how we practice medicine here, because you're right and because the patients deserve to have access to what you know." Sarah stared at the form. This wasn't what she'd expected. She'd anticipated quiet rejection, a suggestion to resign before protocol violations became official. Not this, not integration, not recognition. "There will be questions," Holloway continued, "about your background, your deployments, your service record. Some of it will be classified, I understand that. But the fundamental truth, that you learned a better way to save lives, that doesn't need to stay hidden." Sarah picked up the form. Her hands were still steady now. The adrenaline had metabolized into something else. Fear, maybe, or possibility. "Thank you," she said. "Don't thank me yet," Holloway replied. "You're about to become very visible around here, and visibility always has a cost." Chapter 3. The Cost of Visibility. 2 weeks later, Sarah was teaching a room full of surgical residents her methodology for rapid hemostasis in abdominal trauma. Holloway sat in the back, observing. The residents took notes with the careful attention of people who understood they were learning something that wasn't in their textbooks. The PowerPoint displayed anatomical diagrams, lateral approaches, timing sequences, the precise angle that reduced operative time without compromising safety. But what mattered most was what wasn't on the slides. What mattered was the voice of someone who had learned these techniques not in a lecture hall, but in a place where people died if you hesitated. One of the residents raised his hand. David Chen, no relation to Sarah, a fourth year with sharp eyes and the kind of intuition that marked him as either brilliant or reckless. "These approaches," he said, "they seem designed for when you don't have time for imaging. For when you're operating blind, almost." Sarah paused. He'd asked the exact question that would unlock the door to her past. She could feel everyone in the room waiting for her answer. "Yes," she said simply. "That's where they were developed. Theaters without imaging capacity, limited blood products, one chance to get it right." David glanced at Holloway, then back at Sarah. "Combat, right, or disaster response?" "Classified," Sarah said. "Not unkind, just final." But David was persistent. After the lecture, he caught her in the hallway, coffee in hand, his curiosity still unsatisfied. "My grandfather was Army Corps," he said. "Field surgeon in Gulf War I. The way you operate, it's like watching someone from a different generation, someone who actually had to make impossible choices." Sarah wanted to walk away. Instead, she found herself stopping. "Your grandfather's still alive?" she asked. "Died 3 years ago," David said. "PTSD took him 30 years to become symptomatic. Everyone was shocked, like trauma has an expiration date." They stood in the hallway together, two surgeons separated by a generation, but connected by the weight of knowing what staying alive sometimes costs. "It doesn't expire," Sarah said quietly. "It just waits for the right trigger." That night, in her apartment, Sarah found herself looking at photographs she usually kept locked in a drawer, digital files that shouldn't exist, images from a surgical field in Kandahar, a field hospital tent with mountains visible through gaps in the canvas. Her younger self, standing beside a patient, a local girl, maybe 16, who'd stepped on an IED. Survival probability, 14%. Sarah had operated anyway. The girl survived, lived to be 18 according to the report Sarah had received 3 years after returning to the States. Married, had a child, alive. That mattered. On nights when the screams were loud, that mattered. Her phone buzzed. A text from Holloway. "Patient from 2 weeks ago, the MVA. He came by the hospital today to thank the surgical team. Us specifically for you. Wanted to know if you were a miracle worker." Sarah read it 3 times. A survivor, someone she'd pulled from the edge and handed back to his family. This was supposed to be why she'd come to St. Helena, to accumulate these moments, to build a counter-narrative to the deaths she carried. But it wasn't working. Every survival reminded her of someone who didn't make it. Every thank you echoed with the sound of a flatline. The next morning, David found her in the OR prep room. He'd been scheduled to assist on a thoracic surgery, routine, nothing complicated. But he'd asked specifically to work with Sarah. During the procedure, with hands immersed in someone's chest cavity, he asked the question that made her hands momentarily pause. "Did you lose someone?" he asked quietly. "Someone you couldn't save?" The question hung in the sterile air between them. "Too many to count," Sarah said finally. "But one stays with you." She didn't elaborate. David didn't push. After the surgery, in the hallway, David said something that made her understand why he'd been so persistent. "My grandfather told me before he died. He said the survivors are fine. It's the ones who died that never stop screaming. He said a good surgeon is someone who hears the screaming and keeps operating anyway." Sarah stood very still. "Comment where you're watching from. Let's see how far the stories of real courage and silent sacrifice can travel. Because every person listening has carried someone, lost someone, or kept operating when everything inside them was breaking." Chapter 4. The fracture. Sarah's integration into the hospital's official protocols lasted exactly 3 weeks before the crack appeared. It wasn't dramatic. It was worse than that. It was bureaucratic, a memo from the hospital's legal department flagging questions about her background clearance. Standard stuff: verification of credentials, confirmation of her security clearances, clarification about what exactly classified military service meant in the context of a civilian hospital. Holloway called her into his office again. This time, his expression was different, not angry, concerned. "They're asking for documentation," he said. "Proof of what you did. Verification of your deployments, some kind of official confirmation from the DoD that you're actually who you say you are." "I can't provide that," Sarah said quietly. "Why not?" "Because the work I did, some of it, it's classified. Not because it was special ops or anything dramatic, just because of where it was, who was involved, and what happened afterward. If I release documentation, I violate security protocols. If I don't, the hospital legally can't employ me." Holloway leaned back in his chair. She watched him work through the problem, the same way she might work through a surgical difficulty. Look at it from different angles. Find the pressure point. "What if we approached it differently?" He said finally. "What if the legal requirement isn't documentation of your deployment, but documentation of your surgical training? We could request certification from military medical colleges, records of your training programs, proof that you completed whatever advanced coursework they require." "That exists," Sarah said. "That's not classified." "Then we start there," Holloway said. "We give them enough to satisfy the legal requirement without exposing anything that needs to stay private." It should have worked. Sarah requested the documents, transcripts from the Army Medical Department, certification of advanced trauma surgery training, verification of her credentials. Everything was legitimate, everything checked out, but bureaucracy, like a tumor, had a way of metastasizing. The day after Sarah submitted her documentation, David was waiting for her outside the OR. He looked like someone who'd been sitting with difficult knowledge and finally decided to share it. "There's talk," he said quietly. "Someone's asking questions about your service record, not the hospital, outside. There's a journalist who's been making calls, asking about former military surgeons, about classified operations in Central Asia, about people who might have connections to—" He stopped. He didn't need to finish. Sarah felt something shift in her chest, a reckoning, the kind that came when the past stopped being memory and started becoming immediate. "Did they get any information?" she asked. "I don't know," David said. "But whatever they're looking for, they're serious about finding it. This wasn't a casual inquiry." That night, Sarah didn't sleep. She sat in her apartment with lights off, watching the city, her hands wrapped around coffee that had gone cold hours ago. She'd known that visibility would have a cost. She'd just hoped the cost wouldn't be this high. Her phone rang at 3:47 a.m., unknown number. She almost didn't answer. "Dr. Chen," a man's voice, professional, careful. "My name is James Westbrook. I'm a journalist with the Boston Globe. I've been investigating classified military medical operations in Afghanistan and Pakistan between 2014 and 2017. I believe you might have been involved in work that the public has a right to know about." Sarah's hand moved to hang up. "Wait!" Westbrook said quickly. "I'm not trying to expose you. I'm trying to understand what happened to the people who were involved in those operations. Specifically, what happened to a girl named Amira Hassan. She was 16. She was injured during a conflict-related incident in Kandahar. And according to my records, she was operated on by a military surgeon whose identity is classified. I'm trying to find out who saved her life." Sarah stopped moving. "How did you—" "Get her story. She's part of the reason I'm investigating," Westbrook said. She survived. She made it to the United States. She's a college student now. She's alive because someone operated on her when the probability of survival was minimal. I'm trying to tell that story, but I need to know, was that you?" Sarah was quiet for a long moment. "If you confirm your identity," Westbrook continued, "if you're willing to talk about what you did in those operations, about the decisions military surgeons have to make when the rules don't apply, I think your story matters. I think the world needs to understand that." "No," Sarah said, "I can't do that." "Why not?" "Because staying silent was the only way to stay alive inside. Because the moment she spoke about Amira, about the 17 other patients she'd operated on in that field hospital, about the one patient she couldn't save, the moment she did that, the screams would become real, documented, public, and she'd never be able to pretend the weight wasn't there. Because classified means classified," Sarah said, and hung up. But she called Holloway first thing in the morning. Chapter 5. The Revelation. Holloway didn't hesitate. He immediately contacted the hospital's legal team and then made a call to someone at the Pentagon, a contact he had from his own time in Army Medical. What emerged was a series of conversations that happened in rooms Sarah wasn't present for, decisions made about what could be disclosed and what had to remain confidential. By the end of the week, a compromise had been reached. Sarah's military service was verified, her training was confirmed, her security clearance, still active, still legitimate, was officially recognized by the hospital. But the details of her deployments, the nature of her classified work, the specific operation she'd been involved in, all of that remained sealed. It was enough to satisfy legal requirements. It wasn't enough to satisfy a journalist who'd already caught the scent of a larger story. Westbrook showed up at St. Helena General on a Tuesday morning, credentials in hand, asking to speak with Dr. Chen about the Afghan medical operations of 2014-2017. The receptionist had no reason to refuse him. Journalists had rights. Information was supposedly free. Sarah was in the OR when he arrived. Holloway intercepted him in the hallway. "She won't speak with you," Holloway said simply. "She doesn't have a choice," Westbrook replied. "This is a matter of public record. The operations I'm investigating involved the death of at least 62 civilians in a bombing raid that was supposed to target a Taliban compound. Your surgeon was there. Your surgeon operated on survivors. And your surgeon's identity has been classified in a way that suggests military command wanted that work kept quiet." Holloway's expression shifted. It was subtle, just the tightening of jaw muscles, the way his eyes hardened. But Sarah recognized it later when Holloway found her after the surgery and told her what Westbrook had said. "Is it true?" Holloway asked. "Were you there when civilians died?" "Yes," Sarah said quietly. "Did you operate on survivors?" "Yes, 17 of them. The youngest was 9 years old. The oldest was 73. All of them had injuries from fragmentation. All of them were bleeding to death when they brought them to our field hospital." Holloway was silent. He was doing the calculation, the moral arithmetic that every surgeon had to do when operating on people whose lives had been destroyed by the machinery of war. "Did you save them?" he asked. "I saved 9 of them," Sarah said. 8 didn't make it despite everything we tried. 1 died on the table from an injury that was never survivable. And 1, a girl named Amira, she survived. "And the journalist knows about her?" "Yes. He's been trying to find me to tell her story, to let people know that something good came out of the bombing, that one girl lived, made it to college, has a future." "Ooh, but you didn't want to be part of that narrative," Holloway said. "It wasn't a question." "I couldn't be part of it," Sarah replied, "because the moment I confirm who I am, the moment I attach my name to those operations, I'm not just telling Amira's story. I'm validating that everything that happened there was worth it. That the 53 people who died in that bombing were acceptable losses because 8 people survived medical treatment. That's not a story I'm willing to be part of. Holloway walked to the window. Outside, November rain was starting to freeze at the edges, the beginning of winter's hardness. Westbrook is going to publish the story whether you cooperate or not, Holloway said. He has enough information. He has Amira's story. He has military records that are part of the public domain. He doesn't need you. I know. So your silence doesn't protect the classified information. It just protects you from having to think about what happened. Sarah didn't respond because there was no response that was true. The patient from 2 weeks ago, the MVA, he came back to see me yesterday, Holloway continued. Wanted to thank us again. He said he's been thinking about how close he came to dying and how a surgeon he'd never met made a decision that saved his life. He asked me if I thought his surgeon thought about him, if she knew how much her hands mattered. Holloway turned back to face Sarah. You do think about them, don't you, the ones you saved? Every day, Sarah said. Then maybe it's time to stop thinking about the ones you couldn't save and start accepting that you saved the ones you did. Chapter 6. The Wait. Sarah didn't hear the news through official channels. She heard it from David, who was scrolling through the Boston Globe on his phone at 6 a.m. and found the article waiting there like an accusation. The Silent Surgeons, Military Medicine's Hidden Heroes, the headline read. Below it, a photograph of a Kandahar field hospital that Sarah recognized immediately, the same tent where she'd operated on 17 civilians in a single 48-hour period. And below that, the story of Amira Hassan, now a sophomore at Boston University, studying to become a physician herself. Dr. Chen, David said quietly. He'd come to find her in the pre-op area. Is that you in that article? She didn't deny it. Instead, she read the story right there in the sterile pre-op room, watching her own history become public knowledge. Westbrook had done his work thoroughly. He'd interviewed Amira. He'd gotten confirmation from military medical sources about the scale of the operations. He'd even managed to track down 3 of the other survivors Sarah had operated on, people Sarah had never expected to hear from again. The article didn't name her directly. It referred to an army surgeon, identity classified, whose decision-making under impossible circumstances saved lives that would otherwise have been lost. But anyone in the hospital, anyone who'd paid attention to Holloway's recent push to integrate Sarah's methodology, would know exactly who that surgeon was. By noon, Sarah's phone was ringing. Holloway, the hospital administrator, the legal team, everyone wanting to know if she'd cooperated with the journalist, if she'd violated any security protocols, if she was aware that her identity would likely become public knowledge within 48 hours. She answered none of their calls. Instead, she sat in her office, a small room with a view of the parking lot, and read the part of the article that Westbrook had written about Amira. She was 16 years old when a bomb destroyed the marketplace near her home. Her younger brother died in the blast. Her parents were treated for minor injuries, but Amira was caught in a secondary collapse, a structure falling, and suffered extensive internal injuries. Military medics transported her to a field hospital where an army surgeon made the decision to operate, despite a probability of survival that was less than 15%. I remember being on the table and thinking I was going to die, Amira recalls. And then I remember the surgeon's hands. They were moving so fast but also so carefully, like she was dancing with my body, not fighting it. I don't remember her face. I don't remember anything except thinking, this person is saving my life. Today, Amira Hassan is 22 years old, a pre-medical student at Boston University, and the reason Dr. Sarah Chen, the surgeon who operated on her, decided to tell her story. Sarah set down the phone, so Westbrook had named her, not through confirmation but through Amira's own words. Sarah Chen, the army surgeon who'd saved a girl's life in Kandahar. Sarah Chen, whose methodical approach to emergency trauma surgery was the difference between death and survival. Her hands were shaking again, but this time it was different. This time it wasn't fear, it was something else, something that felt like relief and terror in equal measure. Holloway found her an hour later, standing in the same hallway where David had first asked about her hands. "The hospital's released a statement," Holloway said. "We're confirming your military service record. We're officially integrating your trauma protocols into the hospital's curriculum. And we're offering you a position as head of advanced trauma surgery." Sarah looked at him. "You're making me more visible." "I'm making you impossible to silence," Holloway replied, "because visibility isn't your enemy, Chen. Silence is. Silence is what kept those screams alive inside your head. Visibility, acknowledging what you did, what you know, what you're capable of, that's what lets you finally breathe. If this story stays public, then people will know that military surgeons do impossible work in impossible circumstances," Holloway interrupted. "They'll know that someone saved a girl who was supposed to die. They'll know that your hands matter, that your presence matters, that you matter. If this story stays public, then every time I operate, someone will think I'm a hero. And I'm not a hero, Holloway. I'm just someone who learned how to cut and sew quickly enough to keep people alive." "That's exactly what a hero is," Holloway said. "Someone who does the work when it matters most. If this story has already moved you, hit the like button. It helps more people discover stories of compassion and duty." Chapter 7. The Reckoning. The journalist didn't stop with the Boston Globe article. Westbrook continued his investigation, filing FOIA requests, contacting military medical historians, building a broader narrative about the invisible burden carried by military surgeons who operated in theaters where the Geneva Convention was more suggestion than law. And somehow, in the midst of all that scrutiny, Sarah received an email from Amira Hassan. "Dr. Chen," it read, "I know my story being public probably feels invasive. I know having your identity revealed wasn't something you chose, but I needed to tell you something. I remember fragments of that surgery that I didn't tell the journalist. I remember you speaking. You kept saying the same thing over and over. You're going to live. You're going to live. Like you were promising it to me. Like you believed in it so much that belief alone could make it true. I've spent 6 years wondering who that voice belonged to. Now I know. And I want you to know that your voice saved me twice, once with surgery and once with hope." Sarah read the email 17 times. Then she called Holloway. "I want to meet her," Sarah said. "Amira, I want to talk to her." "I can arrange that," Holloway said, "but you understand what happens after you do. You'll be confirming the narrative. You'll be accepting your place in the story that Westbrook has constructed." "Yes," Sarah said, "I understand." They met at a coffee shop near Boston University campus. Amira was exactly like Sarah had imagined her would be, young, intelligent, carrying her own weight of survival with the same careful precision that Sarah carried hers. "I have 17% scarring on my intestines," Amira said by way of greeting. No small talk, just direct acknowledgement of what Sarah had done to her body to keep her alive. "Sometimes it bothers me. Sometimes I notice it when I'm doing my pre-med anatomy coursework. But mostly I just notice that it means I survived." Sarah didn't know what to say. The protocols for this moment, meeting a patient you'd operated on years ago, a patient whose survival had cost you something nameless and permanent, there were no protocols. "I remember your voice," Sarah said finally. "I remember calling your name through the surgery. I remember promising you that you'd survive." "Do you remember why?" Amira asked. "No," Sarah said. "At the time, I didn't know if you would survive. I was making a promise I didn't know if I could keep." "Exactly," Amira said. "That's exactly why it mattered. You made me a promise even when you didn't know if you could keep it, and then you kept it anyway." They sat in silence for a moment, two women separated by 15 years and brought together by the specific moment when surgery became faith. "The journalist, Westbrook, he's been trying to get me to say that the military's operations were justified, that the civilians who died were acceptable losses because some of us survived," Amira said. "But that's not what I believe. I believe that you saved my life. I believe that's good. And I believe that the bomb that injured me in the first place was bad. Both things are true at the same time, and I think the world needs to understand that." Sarah looked at this young woman who'd been 16 and bleeding and supposed to die, and who'd become someone who could hold two incompatible truths without letting either one overwhelm her. "I spent 6 years not wanting to be visible," Sarah said. "Not wanting to be the surgeon who saved you, or the woman at the field hospital, or any of it. I wanted to just be the person who operated on trauma cases and helped people survive and didn't have to think about the reasons they were injured in the first place." "That's not possible," Amira said gently. "You can't separate the surgery from the reason for the surgery. The best you can do is acknowledge both and try to do better the next time." After they parted, Sarah walked through Boston in the cold November air, Amira's words sitting heavy in her chest. Try to do better the next time, not undo the past, not pretend the past was different, just try to do better. Chapter 8. The Integration. By the time Sarah formally became head of advanced trauma surgery at St. Helena General, her face had appeared in 3 separate articles about military medicine. Veteran integration into civilian healthcare, and the invisible burden carried by people who'd operated under fire. It wasn't the invisibility she'd planned for, but it was integrity, and that turned out to matter more than she'd expected. David was the first surgical resident she formally trained in the field methodologies she'd developed. He came into the training with the humility of someone who understood that his textbook knowledge was useful but insufficient. And he learned not just the techniques, but the philosophy behind them. That surgery was about being present in the body you were operating on, about understanding that every incision was a dialogue between surgeon and trauma, about knowing that sometimes the impossible becomes possible if you refuse to accept its certainty. 3 months into her position, St. Helena General experienced a mass casualty event, a structure collapse at a commercial building in downtown Boston. 16 people injured, multiple internal bleeding cases, limited time for imaging. The kind of crisis that required the exact methodology Sarah had integrated into the hospital's protocol. When the first critical patient came into OR1, it was David assisting, Torres handling anesthesia, and Sarah with her hands already moving with the economical precision of someone who'd learned that time was the only resource that couldn't be manufactured or borrowed. 47 minutes later, the patient was stable. Then the next one, then the next one. By the end of the day, St. Helena General's surgical team had saved 11 of the 16 injured people. The 5 who died came in with injuries that were simply unsurvivable, not a failure of surgery, but a limit of biology. When the press came asking for comments about how St. Helena General had managed to save lives during such a critical event, it was Holloway who spoke, but he made sure to credit the methodologies that Sarah had integrated into their protocols. "We have a surgeon who learned to operate under conditions of extreme scarcity and uncertainty," Holloway told the reporter. "She brought those techniques here, she trained our staff, and today, those techniques meant the difference between survival and death for multiple patients. That's not luck. That's surgical excellence born from hard experience." Sarah watched the interview from the observation room of the lounge. She saw herself reflected in the television screen. a woman in surgical scrubs, exhausted in the way that came only after adrenaline had burned through everything else, but also somehow lighter than she'd been in years. Holloway came to find her afterward. "You're a different person than you were 3 months ago," he observed. "I'm carrying the same weight," Sarah replied. "I just stopped trying to hide it." "That's what integration actually means," Holloway said. "Bringing all of yourself into the space, not leaving any part of you waiting outside the door." Chapter 9. The Redemption. Winter came early to Boston that year. By December, snow was already accumulating, not melting, just building up week after week until the city was pressed under white silence. Sarah was in her office when the letter arrived, handwritten, posted from a village address in Pakistan. The envelope was thick, the paper inside carefully preserved despite obvious travel. It was from the family of Hassan Malik, a boy who'd been 9 years old when he came to Sarah's field hospital with fragmentation wounds to his abdomen. Sarah had operated on him at 2:30 a.m. on a Tuesday. He'd survived surgery, he'd survived recovery, he'd survived the evacuation to Bagram, and according to his sister's letter, now written at 27 years old, he'd survived into adulthood, despite the doctors saying he'd likely develop complications. "My brother is graduating from high school this year," his sister wrote in careful English. "He will become a mechanic. He will have a life because you saved him. I don't know if you remember him. You saved so many people, but we remember you. Every day we remember the surgeon who gave my brother his future." Sarah read the letter while sitting at her desk, watching snow fall against the window. And for the first time in 13 years, the screams weren't louder than the gratitude. She called Holloway. "I want to set up a medical fund," she said, "for military surgeons transitioning to civilian practice, for people who need help integrating what they've learned in field medicine into hospitals, for keeping them from disappearing into silence like I almost did." "I can help you set that up," Holloway said. "What do you want to call it?" Sarah thought of Hassan Malik, graduating from high school, of Amira Hassan, becoming a physician, of the 17 people she'd operated on in a field hospital in 2014, most of whom had survived, all of whom had futures. "The Second Chance Fund," Sarah said, "for people who get saved by surgery and for the surgeons who do the saving." Holloway was quiet for a moment. "That's beautiful," he said finally. The fund grew. Other military surgeons, people like Sarah, people who'd learned to operate on people whose injuries were caused by war and politics and distance from civilization, began contributing. They shared their techniques. They trained new generations of surgeons, and they stopped being invisible. By January, St. Helena General had expanded its trauma surgery program. By March, they'd trained staff at 4 other hospitals. By June, Sarah was being invited to medical conferences to speak about the integration of field trauma surgery into civilian protocols. But what mattered most was that on a Tuesday evening in April, a former patient came by to visit the surgical ward. An older man, maybe 60, with the careful movement of someone whose body had been reassembled by surgical intervention. "I wanted to thank Dr. Chen," he said to the receptionist. "She operated on me during a structural collapse about 6 months ago. Saved my life. I wanted her to know I'm doing well. I'm back to work. My family got to keep me." Sarah happened to pass through the waiting area at that exact moment. She stopped. She looked at this man's face. She recognized him in the way a surgeon recognizes someone she'd held together while their body was falling apart. "You remember me?" the man asked, surprised. "I remember your injury," Sarah said. "I remember your vitals stabilizing after hemostasis. I remember your wife was waiting for you in recovery." "She was," the man said, smiling. "She's still waiting. We're still together. Because of you." After he left, Sarah stood in the hallway for a long time. The fluorescent lights hummed their eternal 60 hertz song. Rain was starting to fall outside, moving sideways against the ER doors. She thought about the screams, how they'd seemed so loud when she was trying to ignore them, how they'd started to quiet down once she'd stopped trying to hide. She thought about Hassan Malik graduating from high school in a village in Pakistan, about Amira Hassan preparing to become a physician, about the man who'd just left, who got to go home to his wife. She thought about her hands, how they'd learned to operate in a field hospital, how they'd brought those techniques to a civilian hospital, how they were still saving lives. And for the first time, the weight wasn't crushing. It was just weight, the weight of having survived, the weight of continuing to survive, the weight of transformation. Subscribe for more stories of courage, healing, and redemption. Thank you for watching the case of the chief surgeon mocked her method. 30 seconds into the surgery, his entire team knew the truth. See you in the next one. Epilogue. Some healers don't carry their scars as proof of damage. They carry them as proof of persistence.